Hello friends, my name is Ankit. I make educational videos on US healthcare. I also write blogs on various healthcare trends. I will leave the link below in the description for your reference. I'm back with another video on one of the FHIR concepts. If you are new to my channel, thank you. Please click the like and subscribe button for access to the future content. In this particular video, we will talk about DAVINCI Peer Data Exchange Formulary Implementation Guide. Now, for those of you who are not aware what exactly is the formulary, when as a member you visit a provider and the provider treats you for a certain condition, they give you a prescription. You take the prescription to the pharmacy and the pharmacy fills the prescription and you pay the copay based on your insurance coverage. Not many of you may be aware that there are different prescription drug categories which are part of the drug formulary. So this particular IG focuses on the two resources which are medication list and medication resources. We'll talk more about it in the next few slides. What exactly is the DaVinci Peer Data Exchange Guide? The implementation guide defines a FHIR interface to a health insurer's drug formulary information for patient or consumers. A drug formulary is a list of brand name and generic prescription drugs a health insurance agrees to pay for, at least partially as part of the health insurance coverage. Drug formularies are developed based on the efficacy, safety, and cost of drugs. The primary use case for this FHIR interface enable consumers, members, and patients to understand the costs and alternatives for drugs that have been prescribed and to compare their drug costs across different insurance plans. Under the formulary use case, there are multiple actors. Member is a person to whom healthcare coverage has been extended by the policyholder, generally their employer or any of the covered family members. Sometimes referred to as the insured or insured person. The cost of medications for a member is a function of the drug coverage under the health insurance plan, their benefits based on their already satisfied deductible, and the pharmacy where their prescriptions are filled. Consumer, a person who may or may not be a member, who wishes to explore the formulary content and plan level coinsurance. Health plan, a provider of the insurance coverage that often includes a drug coverage plan which publishes formulary content and plan level coinsurance information through the drug formulary FHIR API. Now let's talk about medication copay under healthcare plan use case. The use case allows a member to determine the plan level estimated cost of each of the medications under the drug coverage of their current health plan, and specification query for the formulary service for cost information about the drugs that the member has interest in that provides the plan level estimate. Now, some of the things which are out of scope for this IG are what all are my medications. The in-scope thing is tell me about my medication, and the formulary service returns the information about the copay that the member is responsible for paying if they opt to choose for that drug under that particular formulary plan. The next use case we talk about is shopping for health plans. The members can always use this formulary and copay information to shop for health plans. This use case allows a consumer to compare the drug coverage of several different health plans and determine which plan has the lowest plan level estimated cost based on their medications of interest. The application can retrieve the consumer's medication list from an electronic health record system where the consumer's patient data is stored outside the scope of the implementation guide. The consumer could also independently maintain their medication list in the application or elsewhere. The application identifies the relevant formulary services to retrieve the list of health plans provided by that payer. Then by each plan, the application queries the formulary service to retrieve the plan level estimated cost specific to the consumer's medication list. Note that for this use case, the health plan could provide non-authenticated or open access to the formulary. Non-authenticated access should not maintain any records that could associate an individual with the medication or the plan queried. In this particular use case, the things which are out of scope are what all are my medication, tell me about the payer endpoints. So what we are interested is tell me about the coverage plan, tell me about the meds which I can apply for. There are different access methods for the formulary. We have authenticated API and unauthenticated API. Authenticated API. Access to the formulary service when integrated with protected health information or personally identifiable information as part of the patient access API shall be protected through an authorized authenticated transaction as described in the DAVINCI Health Record Exchange FHIR Implementation Guide. What is an unauthenticated API? When exchanging formulary data exclusively, which is public information without any PHI or PII, the formulary services may also be accessed through the API that does not require authentication or authorization. The formulary server shall not maintain any record through the unauthenticated API that could associate the consumer with the medications queried. What is the formulary structure? Formularies in the United States are normally published by health insurers on an annual basis, with minor updates during the year. It is critical that health insurers update their published formularies following these minor updates. Insurers regularly administer multiple health insurance and drug coverage plans, and each of these plans may have its own formulary. Each formulary contains a set of drugs and their limits or requirements. Drugs are placed into tiers that largely determine the cost to the consumer or patient. The number and the purpose of the drug tiers varies across payers. Each tier has an associated cost sharing model that includes deductible and or coinsurance component for drugs in the tier when purchased through various pharmacy benefit types. In addition to the drug tier, drugs may also list requirements on the patient, age or gender, or limitations on prescription, for example, quantity limits. Currently, we are looking at the resource relationship model. So as we talked about the formulary, there are two different resources that are part of this implementation guide, the medication list and medication knowledge. This particular image describes the relationship between various drug formulary, drug tiers, and the plan coverage information. Hope this video provided valuable insight to you. If you are looking for any specific content, please message me. Please like and subscribe to my channel, and until next time, see you all. Have a good day.